All right, welcome everyone to the session this afternoon on strengthening health emergency preparedness and response through Project ECHO, a global collaboration with the WHO and WHO Afro. I'm Bruce Struminger. I'm a professor of internal medicine at University of New Mexico and one of the associate directors at Project ECHO, helping lead our global health initiatives. And we have a wonderful panel of 3 colleagues today, one of whom is with us on stage, Dr. Heini Uutinen, who is going to go through the intros now. She's the head of Learning and Capacity Development Unit at the World Health Organization's Health Emergency Program based in Geneva. So she's here in person live. Thanks, Heini. We also have Celine Barnadas, who's a laboratory expert and technical officer with the Public Health Laboratory Strengthening Unit of the WHO Health Emergency Program. She is coming to us live from Lyon, France, from the WHO office based there. And our third colleague is Dr. Bukari Bangunku, and Bukari is a medical doctor and also the head of Learning and Capacity Development for the WHO Health Emergency Program in Africa. And Bukari recorded his presentation, and we're going to play that recording, but he's also live on Zoom and will be participating in the Q&A session. So the agenda will be that we have 3 presentations, the first from Bukari, the second from Celine, on laboratory programs. Bukari's will be on the Africa Health Emergency collaborations. And then third, Heini will present from the Geneva Global Health Emergency Program perspective. And then we'll have, we hope, about 10 or 15 minutes for questions and answers from the audience. So with that, if we can roll Bukari's recording, that would be terrific. Oh, let's go back to those session objectives, if you can. Great, this gives me the opportunity to review our session learning objectives. So those include increasing awareness of the potential of digital learning platforms for health emergencies preparedness and response. In response, that's objective 1. The second is learning about the strategy and outcomes of 3 innovative collaborations between WHO headquarters, WHO Africa, and Project ECHO. And the third is identifying best practices and lessons learned from these successful digital learning initiatives. So those are our learning objectives. So if we can proceed to the recording from Bukari, that would be terrific.
Hi, everyone. My name is Bukari. I am working with WHO Regional Office for Africa in Congo, in Brazzaville. And from here, with the whole training team, we are sending you our greetings and a very warm welcome to this panel. I'm also passing you the greetings and regards from our Regional Emergency Director, Dr. Salah. It is a real pleasure for me to represent WHO Afro in this panel. I am excited, I am happy to share our working experience with ECHO. My presentation is going to focus on 2 aspects. The first aspect is I will share with you how WHO Afro was able to quickly leverage the ECHO facilities and the webinar platform to broaden the scope and the coverage, to broaden the reach of our virtual learning activities and efforts. And this was done right from the early phase of the pandemic in 2019-2020. I will also explain how we were unable by ECHO to disseminate critical information to healthcare providers and public health officials. I will also show you how we were facilitated and supported by ECHO to share best practices, to democratize knowledge, and most importantly, to save lives. This is the first aspect. The second aspect, I will present how the EPR training program has evolved so far, how we have matured so far, and how we have progressed, and our perspective. So please stay focused, stay concentrated, and stay with us. Listen, in time of crisis, there are always opportunities, and the COVID pandemic has been one of them. The COVID pandemic is a good example of opportunities for learning and training for us. This pandemic placed on WHO Afro a huge and new demand for information and training. Let me put it simple. When COVID-19 started in late 2019, early 2020, the member states in Africa, in Afro region, were really looking for correct information about this new disease. And at that time, WHO was seen as the only credible voice and the only reliable source of information for them. The public health and social measure that drastically reduce ability and possibility to conduct face-to-face training. So the bigger driver, the trigger for our work has come from this pandemic, which has negatively impacted on the mobility. Consequently, WHO was required to use digital learning tools to address training needs and strengthen the workforce capacity. It was in this context that we reached out to ECHO, the UNM, to serve as a catalyst for this digital transformation, given that Project ECHO already had a long history in evidence-based model of learning of health workers and peer-to-peer learning and education. Together with ECHO, we have launched and we have conducted different virtual learning and dialogue series targeting health professionals across Africa, across all disciplines, across all occupations, and all levels of the health sector and health system. As you can see on this slide, with support from ECHO, we were able to reach out up to more than 120,000 participants, 120,000 individual attendees. And you can see on this table the breakdown by year. So we have conducted, with support from ECHO, almost 300 events. I mean 300 webinars and meetings. And we have involved over 600 panelists, 600 subject matter experts to conduct these webinars and these meetings. To be able to conduct this, we have devoted around 500 hours of session and over 800 planning hours. This planning time was done between WHO team and ECHO team and the experts. I put down, just for your idea, our session was done in English with interpretation in French and Portuguese. And we have involved over 1,000 interpreters. And for each session, we would spend around $1,500 for the interpretation costs. So, to be able to do that, WHO Afro leverage its convening role and power to create space for dialogue, to create space for peer-to-peer experience sharing, and to create space for collaborative problem solving. On the other hand, ECHO brought decade-long experience on case-based learning. ECHO brought the quality improvement approach, and also the support for data collection, the support for monitoring and evaluation. Here, we wanted to show our coverage in terms of geographical. We have reached over 166 countries. In terms of gender distribution, 60% men and 40% female. But as you can see on the map, with support from ECHO, we have gone beyond Africa. We have reached out to the whole world. You can see almost 90% of our attendees was from the African continent, but we have also reached to many in the American continent, mainly from the US and from Canada. We also reached out to Europe, to Asia, to Oceania. Here, we wanted to show the distribution over time of our activity. From the start, around April 2020, until now, we have permanently, continuously organized webinars and meetings with the support from ECHO. And you have some peaks. Towards the end of 2020, you can see that there were some peaks, and also in June 2021. This corresponds to when we conducted the dissemination of the Integrated Disease Surveillance and Response, the third edition of RDSR guideline, when, with the support from ECHO, we were able to adapt a 7 days face-to-face training into a virtual learning, virtual training for healthcare workers. We also put in place virtual community of practice on surveillance. We have a regional community of practice and a country community of practice. And this was done with support from ECHO. Here, we wanted to show that with the support from ECHO, we are working with Africa CDC to implement a program, a joint initiative that we call AVOC Search. For the moment, we have targeted 16 countries. And in this country, we are setting up digital learning platform for the continuous training and learning of a healthcare professional. Here, we just put some examples for you to see Mauritania, Niger, Togo, Botswana, but we have other countries like Chad and other, where we are installing, we are setting up the digital learning system with the support from ECHO and also the support from the INSP, Institut National de Santé Publique de Côte d'Ivoire. Here we have done some analysis just to show that we are aware of some limitation to consider and some aspect to mitigate. We also know the strength and opportunity given by the virtual learning. But what is important, the key, is to adapt the strategy, the learning approach. We need to adapt each strategy, each approach, and the technology wisely in conjunction with other training methods to create an effective learning environment. So,
great. Thank you, Bukhari, for that initial presentation. We're looking forward to having you join us live for the discussion. And that's a wonderful summary of our work together over the last couple years. One thing I want to highlight is not only was this a collaboration between the ECHO Institute in New Mexico and WHO Afro, but the ECHO India team has been an integral part of the collaboration with both WHO Afro and WHO headquarters, that we've worked as a collaborative team with our colleagues in India and New Mexico, working together with our WHO colleagues. And we'll talk more about that during the discussion. So now we'd like to move to Celine. And Celine, you are, I think, on Zoom right now. And if we I'd love to hand the baton to you, the microphone, and we'll move.
Can you hear me?
Yes, Celine, we hear you, and Haney is going to advance your slides when you ask her to. So
Okay, great.
over to you. Thanks for joining from Lyon.
Thank you so much. It's really a great pleasure to be part of this panel, be here with you tonight, or maybe this afternoon, actually, in Albuquerque. So thank you so much. It was a great, it's great to follow Bukare's presentation. And what I'm going to share with you is just some insight from, as Bukare said, an opportunity that arose from the pandemic, which was to set up a platform to enhance peer-to-peer exchanges, good practice dissemination, in this case for laboratories. So it's more restricted, scope of a community practice. So next slide, please, Heini. Thank you. So maybe just before I get into this, I wanted to take a small step back. What we do in the unit, we're sitting in WHO headquarters in the outpost office in Lyon, and our mandate is to help strengthen laboratory capacities, in order to support member states to be ready to detect, respond to epidemic and pandemics earlier, faster, and safer. And how do we do that? Well, we do that, providing normative work and guidance, standards, supporting capacity strengthening efforts, supporting institutions, infrastructure, and personnel, staff training. And so you can see, I've added the links towards our website in case you would like to see more information about the type of work we do. But basically, if we focus on training, we used to do that in more traditional ways. So we would usually conduct training of trainers with envisaged cascades at national levels, and that was really, resource intensive. Also, as you can see here with the example of biosafety training that was done, we would usually have, train and enrich many countries and large numbers of people. We also used to have and still have some training packages or online materials, which over the years, have enabled us to disseminate guidance and train people. But now I'm going to focus more onto what's been really special with this community of practice. So next slide, please. Thanks. So in the early days of the pandemics, labs in many sectors were facing many challenges. They had to detect and adapt new protocols, to adapt to new protocols, not knowing how good were new tests available on the market, not having access to the regions they needed. And so there was really a need to exchange experiences and best practices. We couldn't organize regional workshops for the reasons with traveling being so difficult. And so we initiated a community of practice for reference labs, so labs at a national level, usually in capital cities, that would test for COVID-19. And this was in partnership with two regions, actually, the Eastern Mediterranean region and the African region. And so the sessions would be 1.5 hours long. They would feature some presentations around guidance, best practice dissemination, and then at the end, we would allow for some Q&A time with speakers answering the question from the audience. And in average, we had about 100, 150 participants, but that quickly grew. Next slide. So now if we make a big step in the where we are now, 3 years and 45 sessions later, we have redefined our goal, and we're supporting a larger range of laboratories, and I'll come back to it. And also I'd like to highlight our key objectives. So initially we had two objectives really: disseminating guidance and enhancing peer-to-peer knowledge sharing. And we've learned as well from that webinar series, actually it's an amazing feedback loop and amazing mechanism, which allows us to hear from the difficulty or the challenges on the ground, and then be able to integrate that into the way we design training materials or other tools to be more adapted to the needs and to help clarify some of the needs in countries. Next slide. In terms of our ability to, next slide, please. Hasn't changed on my screen. Yeah, it's great. Thank you so much. So in terms of so where we are, so I say like we used to have 150 participants. Now, 45 and 3 years later, we have about 40,000 cumulative participants from over 2 countries and territories. And if you look at the dashboard here, that gives you a representation of where participants are coming from. This dashboard, including that's been prepared by WHO ECHO, including participation since June last year. And we have now, when we initially focused on national reference laboratories, we now have laboratory stakeholders from over 1,700 places of work. And we have them coming from reference and public health laboratories, from Ministry of Health, research institutions, so different sectors. As I mentioned before, this is an extremely valuable source of feedback for us. And as we have been progressing over the years, we've been developing as well different webinar products. So notably a one-pager document where we summarize the key discussions, what was discussed during the session, and we provide direct link towards resources that participants may find helpful. And very importantly, we initiated about a year ago a collaboration with Project ECHO to strengthen this initiative, strengthen our monitoring and evaluation framework, and be able to, continue to provide this series. And so, with our next slide, please. Thank you. So, strengthening this M&E. We can see that most of our participants come from national reference laboratories, but as I say, they also come from the subnational level, which is something that's very, very interesting. It means that that cascading is already happening. We see they're coming from, they're mainly laboratory staff, but as I mentioned, we have them coming from many places of work. And if we ask participants what they find the most helpful in the series, most will say learning the latest technical developments, so having access to that information, hearing experiences from other countries, and also importantly, accessing WHO documents such as a guidance that they may not have been aware of or have access to before. We're wondering as well how, what is the impact of this? Does this lead to action? And participants are reporting, 1/3 of them sharing what they have learned about the product with colleagues, looking up additional information, improving a process in their workplace or the way they work. And that's very meaningful to us because that means, this is not only a 1.5-hour session, this is only something that can, again, cascade with colleagues and others and lead to changes in practices. So originally we focused on COVID-19, but as time went, we started broadening the scope of the series. Next slide, please. Thanks. And so we've been utilizing this amazing tool, which is this community of practice and webinar series, to address other health emergencies. And here is the example of actually our first webinar run jointly with ECHO last year, which was on Mpox. And so if you may remember, May 2022, first cases of Mpox outside endemic countries, 23rd of May, WHO publishes its testing guidance for detection of the Mpox virus. And just a few days later, we're able to organize and deliver these webinars that explain the guidance documents. And we had participation as well from 2 of our WHO collaborating centers, 2 of our laboratories that share their testing protocols and expertise with over 1,500 participants online, over 3,000 that have registered and received these follow-up materials, as you can see on the right, that we produced, over 180 countries reached. So really, we were able to very quickly disseminate information and create networks for the laboratories. Next slide, please. Thanks. So I'll finish. I'll finish here. You can see, the number of events that happens every year. This is just a snapshot from last year. In 85% of cases, those are like infectious hazards that are involved, and we have some of the key diseases coming back here. And really, as I hope I've been able to share how this online platform is allowing us to quickly disseminate the latest guidance and information to prepare the lab facing the health emergencies that are ongoing, but also, allowing us to better understand the gaps on the ground and adapt our materials so we can, support countries better. So really, this is showing the potential of this online session for rapid and global dissemination of work practice and scientific evidence. And we have still challenges to tackle. We organize these sessions in 6 languages, which allows actually, better engagement from subnational level, having the sessions in English, French, Spanish, Arabic, Russian, and Portuguese. But this is also, there's challenges associated with that. There's challenges associated with the time zone having such a global audience. And we really like also moving forward to focusing sessions more on problem solving to increase the impact they may have. Next slide, please. So with this, I would like to thank you again very much for the opportunity to be with you so remotely today. And thanks the staff at WHO, Lyon office, in the regional office, the ECHO team, and all the panelists and participants of this series. So thank you very much.
Thank you, Celine. There's some clapping in the audience. Thanks for that presentation. We're going to transition to Heini giving her presentation, and then we'll come back to you for Q&A in a few minutes. Heini, over to you.
Great, we are in a good speed here. So I'm Heini from the headquarter function in WHO in Geneva, Switzerland, working in the Emergencies Learning Unit. I'm leading it. And in the future, all of this work that was just presented by Dr. Bukare and Celine, my colleagues, actually we have this great chance to work with the Institute ECHO as our collaborating center for World Health Organization. So this is a great 3 years of past experience has brought us together under the framework of the collaborating center. So I'm working on the work area that provides the real-time learning response in epidemic, pandemic, and other health events. And this is really a knowledge piece that we provide. This is the bit that comes before the live classes. So this is the online dissemination of WHO's guidance, evidence-based materials that we turn into online formats and provide to the world in free, open, accessible, low bandwidth adjusted formats. And we do it through this openwho.org platform that has been in operations for 6 years, and it grew exponentially during the pandemic. We've received a great award this year. We are the Platform of the Year of the Learning Performance Institute. We think that this is all credit to our science and technical teams like Dr. Bukare, Celine, and others who host the knowledge peace learning on the platform. And it's really worked for multiple infectious disease outbreaks, in particular in African context. We've hosted learning for all viral hemorrhagic fevers, for yellow fever, meningitis, any infectious disease that one can think of. And we've now, during the pandemic, really scaled up the platform. We've provided learning in multiple languages, multiple learning resources. We've produced the courses really fast, presenting WHO's guidance in a format that can be then taken by the learners and adapted and used in other contexts, providing cascade training, providing facility level materials going forward. And it's been really a story of growth. We've gone from 100,000 learners into 8 million just in 3 years, 3.5 years now, and we continue to grow. We have about 3,000 new learners registering every day to the platform. And this is, it seems it's self-paced. It works for learners. Most of the learners are identifying themselves as health workers, because the courses can be completed whenever, from wherever, and in the sequence the learner wants. So it's really a knowledge dissemination, knowledge transfer from us to our learners. And the learners are really committed. Our courses on average last 2.5 hours. Half of our learners have completed their courses. So it's a really high completion rate. We currently host 225 different courses, out of which about 50 are on COVID-19 and 35 on other infectious diseases. And here you see the portrait of different diseases we host, disease learning we host on the platform. The orange ones are the ones you want to look closer, deeper into. Those are the potential next pandemics. Those are the diseases we are most preparing ourselves ahead of the time so that these wouldn't develop as a next pandemic. So they are from the WHO's Research and Development Blueprint, Priority Diseases. And here, just to bring back what Dr. Puccare was presenting earlier, so they've, together with the amazing Project ECHO, they've run live classes for the health workforce on the integrated disease surveillance and response for Africa. We host the knowledge component, the online self-paced modalities, and the integrated disease surveillance and response courses by Dr. Puccare are really popular in the African continent, and these are the courses that our workforce first completes and then goes to the interactive adaptive learning, skills building learning in the Project ECHO modality. And just a few words from the openwho.org platform, what we've seen during the pandemic is that while this online learning only really can address the knowledge piece, it's really worked for our learners. We've increased the number of female learners. It used to be majority men. 60% of learners in the platform used to be men before the pandemic, but during the pandemic, women, the portion of female learners has grown the most. So has grown the number of older learners, senior citizens. We have about 5% of our learners older than 70 years of age. We didn't have this group ever before the pandemic, and these were the most vulnerable people facing the threat of the COVID-19 pandemic. So they really came to the platform in mass. We've noted that when you take the per capita calculation, the population count into the game, our highest number of learners really come from the remote islands, states. And that's been really encouraging to see that our learners are actually in each and every corner of the world. And majority of our learners are from low and middle income countries. 75% of all learners on our platform come from the low and middle income countries. So this has been a great reach of that just-in-time learning that we've been providing on OpenWHO. And from here, the vaccine practitioner, the vaccine health workforce, the integrated disease surveillance and response, many other areas have then advanced to the peer-to-peer classes together with the WHO experts, facilitated classes once they've completed learning on this online self-paced format. And as we are preparing for the next pandemic, we need to do so much more. We need to anticipate so many different scenarios. And I think in our planning, we want to be in multiple channels, in multiple languages, in multiple different formats, so that learners on the front line can actually take all the content and adapt for their need. And this is something that our learners across the board, from immunization to neglected tropical diseases, have stated. And we really want to be fast, frequent, and first in communicating the basic information about transmission modalities, how one can protect oneself, and how we can really easily adapt content also when the technical and the scientific information changes. So we believe that this type of knowledge component can come first, and then you advance to more fine-tuned, refined, facilitated classes like the ECHO model. So this was what I wanted to share, and I want to also leave time for discussion and questions. So over to you.
Thank you. Thank you, Haney. Thank you, Bukhari. Thank you, Celine. Thank you, Haney, for laying the groundwork here. We've got about 10 minutes for Q&A. I just want to say that when we began this collaboration in March, April 2020 with Bukhari in Africa and with your team and others in Geneva, we were responding to a fast-moving public health emergency with very little evidence about the disease and its pathophysiology and best practices. They were all emerging very quickly, and we were trying to reach thousands or tens of thousands of people quickly at scale. For ECHO, we had been working for years at small scale, high quality, super interactive mentoring of small groups over time to go from being novices to experts. We were faced with an opportunity to work with you, but at a much larger scale that we had no experience really working at. And for Bukhari, I know he had said he was usually training 1,500 people a year, usually in groups of 100. So to suddenly start doing digital learning events, webinars, where 1,000 or 2,000 or 5,000 people were participating, we were entering new territory. I think we felt like we were very comfortable working in the Zoom digital space and knew how to work in a very interactive way, but we were all jumping into a new zone in terms of educating and creating a dynamic bidirectional learning opportunity when we were doing this with hundreds or thousands of people at a time. So Bukhari, I wanted to ask you, I know for you this was totally new. You embraced it in an amazing way, and were asking us, you were lining up all the experts, and we were running 3 webinars a week. You had thousands of people joining. You then created the IDSR course that had 12,000 participants to replace what you usually were doing in person over a week for 100 people. And then you started planning these 47 digital learning network programs in all 47 Afro countries. You went from someone who was embracing these digital learning events out of necessity because you couldn't travel and do anything in person, to really becoming proactively seeing the opportunity to take advantage of these digital mediums in a whole new way. I wonder if you could just speak to what your thoughts are for the future of what you want to be doing with blended learning, and how you see the Open WHO asynchronous courses, the ECHO small communities of practice, the larger webinars. These are all continuums, and we'd love to hear from you how you're strategically programming these going forward, what you see as the future for WHO Afro and learning and capacity development in health emergencies.
Yes, Professor, thank you. I want to take opportunity to say a big thanks to you, to your team, and especially to ECHO India, because ECHO India has been critical. It is a dedicated team, and I really want to appreciate their commitment to support us to do all what I have presented. Regarding the future, we have been, I can say we have been trained by ECHO. We consider the work that has been done with ECHO as a legacy, because we have learned a lot. When we started in early 2020, we didn't know what was Zoom. Even we didn't know that it was possible to do interpretation with Zoom. The whole system in WHO was totally new to Zoom. So for me, it was It was, I can say that my meeting with, or my discovering with ECHO was like being saved, because I wouldn't imagine what I was able to do if ECHO was not there to support us. So we continue using the case-based learning and the virtual community of practice, especially now that ECHO is officially a WHO collaborating center. We will continue working with you, with your team, and also working with the Institut National de Santé de Côte d'Ivoire, because ENSP is a super hub, and we are going to continue working with them. We will continue also with the setting up of the digital learning platform in the country where we're implementing the AVOC search. And this is the aspect of the sustainability of the work that we have done with ECHO. We are confident that if we are able to install the digital learning platform in this country, it will be powerful for us to continue installing the community of practice in each country and at regional level, and also to ensure, to enable the training, the capacity building of the healthcare workers. And what we are doing is also an hybrid approach to training. Before, all training was face-to-face and all facilitators would travel. Now some facilitators can do some virtual remote facilitation. And also we are using the Open WHO platform resources as a prerequisite. Before the training, we will send the link to our participant and ask them to complete the Open WHO phase part before they can access to the face-to-face training. So this is what I can say, and over to you. Thank you.
Thank you, Bukhari. So what I'm hearing is you see a blended learning future of harnessing the online resources for self-paced learning with then opportunities for real-time virtual community of practice, case-based learning as complementary and building on each other. Celine, I wonder if you could also reflect on, based on the lessons learned over the last year or two, as we move into our collaboration for the next year, what are you seeing as you know, any new designs for the programs, or how are you imagining changing the structure of our digital learning events? And also, I wonder if you can comment on the bidirectionality, that this has not just been, you mentioned this, not just been a dissemination of information, but really a bidirectional dialogue with your counterparts who run laboratories in over 200 countries, that you have an opportunity to hear and learn from them, as well as you are offering expert knowledge from Lyon. So I'd love to hear how this has become a dynamic, bidirectional or multi-directional learning opportunity.
Thanks, Bruce, and I'll start with that last piece, which I think it has been, the most exciting or the most amazing to us, and that's really, I think, changing, because we, as I mentioned, I think in my, when I was talking before, and I apologize as well if I went maybe a little fast, it was, we didn't necessarily expect that. And I would say there's 3 dimensions to it. There is this dissemination, there is this peer-to-peer exchanges, which is happening with, participants sharing their experiences in the chat, through their questions, and so that's happening as well. And then lastly, there is those questions to WHO, or those questions to the expert that make us aware of some of the knowledge gaps. And we also are very quickly able to sometimes even poll, to understand what are the gaps, what are the technical challenges, what difficulties people are facing. And during the pandemic, for example, that when the rapid tests become available, there were so many knowledge gaps. People didn't really know how to use them. Even the lab staff, they didn't know how safe, what PPEs, what personal protective equipment they had to wear. They didn't know how to dispose of the cassettes when they had been used. So we would follow up with specific sessions to be able to spend more time answering these questions, but also we utilize those questions to inform our training materials, which were then available as training package or as online training courses on OpenWHO. So there was, as you say, these very nice multi-dimensional exchanges, which is such a brilliant opportunity that we have. And then last, so how do we? What changes do we see? We want to keep addressing as we move forward important cross-cutting areas and skills, leadership, and I think that's something that's close to my colleagues' interest as well, or priorities. So leadership, cross-cutting issues, quality, biosafety, so technical issues, and then keep utilizing this platform for guidance dissemination. And what we would like to have is create more interactivity through the collaboration with ECHO, so more interactivity through sessions. And so we can keep engaging further and maybe have more follow-up sessions where we go into the heart of the questions and we try to solve problems, really applying the model that has been developed by ECHO or practiced by ECHO for so many years to be able to solve problems that people encounter in their daily practice. So I'll stop here. Thank you.
Thank you, Celine. We've got about 4 minutes, and I wanted to ask if anyone has a question, 1 or 2 questions from the audience. But I just want to say one of the things that's been so exciting about these collaborations with all of you is that you're all learning professionals. So we have been learning from you. I mean, it's been a super fun collaboration to not just be working with subject matter experts in their technical field, but to be working with learning and capacity development experts. So we've been learning a lot from you on this journey. The lights are a little bright, but is anyone out there got a question or a comment they'd like to ask? Otherwise, I will ask another one. Not seeing one quite yet. So maybe, Haney, I'll ask you, now that we are a WHO Collaborating Center for Digital Learning and Health Emergencies, for me, we're now moving into this phase of a strategic, forward-thinking partnership where we're planning activities. It's not just an organic, reactive, kind of month-by-month thing. It's, we're developing one-year work plans and working forward. What do you see as the opportunity for us over the next 4 years and for WHO?
Yeah, the World Health Organization has about 450 global public health goods. These are the areas of work that we have. About 125 of them are in emergencies only. So all these laboratory diagnostics work, the workforce in Afro, they are our areas of work, critical importance for as our member states have actually assigned these tasks to us. So I think advancing tools, technologies, and thinking how we reach people around these global public health goods is really essential in that we are able to also go. We have some learners already, but we have a big cadre of learners who've never come across any of these resources or chances. So for us to really be in the right channel in the right time for those who need to get the information. In our case, it's the epidemic events, the health hazards, any health emergency or even health humanitarian contexts where we want to reach people like we heard yesterday, the work in Sudan or other really complex emergency settings. So I think for us, it's really to see that landscape and anticipate the learning use case of the coming years. And I think the pandemic teaches us one type of a lesson, but then going forward, I think also the learners in the world change a lot. And the model of coming into the interactive sessions where you actually have somebody to bounce your ideas with, you have a moderator who's an expert. I think this model will work super good, but it's for us to take this to the other level and see where we need to be and how we reach those in particular frontline health responders, in our case, who need the latest evidence in a certain epidemic event. And here, thankfully, we have the country offices, the regional offices, the technical science teams, like colleagues, Dr. Pukari and Celine here, who are able to bring that expertise in. But then for us, I think, and the big challenge for all of us is to look into the world of learning and the change in it and how we are riding that wave. So I think there's a big task for all of us, and not only for us, for everyone, I feel.
Thank you, Heini. Underlying all this discussion is a thread of health equity, and I know that's a priority for all of you. To me, what has been most exciting participating in this collaboration over the last 3 years has been seeing frontline healthcare workers able to interact directly with WHO experts in Brazzaville, Geneva, Lyon, in a way that really was not possible or happening before 2020. To me, this is a new chapter of engagement for WHO from headquarters, from the regional offices, to be able to really extend greater access to not just the senior leaders of the Ministry of Health, but to laboratorians, to doctors, to nurses who work in a district hospital, to be able to learn from you and from each other in this global network that really is a new territory, which I think is very exciting, and we just look forward to collaborating with you to continue to learn on this journey over the next few years. So thanks to all of you. Thank you, Pukari and Celine, for joining late at night from Brazzaville and from Lyon. We really appreciate your being with us. And Heini, thanks for being here in person. Thanks to our audience for joining us, and enjoy the rest of the conference. Thanks very much.